I kind of came in for a specific reason.
Okay.
I'm having very strange tingling sensations, and they kind of start like in my head here, and then they kind of travel up my body, and it almost feels like someone's playing with my hair when there's no one there. Like I'm alone in the house, and I just feel like pulling back and forth, and just a strange kind of like. Then it goes all the way down my back and sometimes even to my feet. I'm sitting alone, I'll feel that same kind of tingling in my feet and toes.
Yeah.
It feels like sometimes I have socks on when I don't. I'm barefoot, but I'll feel that kind of like cloth fabric feeling. So it's very, very strange.
Oh, that's very interesting. And when did this tingling sensation start for you, Katie?
It started about 2 weeks ago.
2 weeks. Is there anything in specific that may be changed about your lifestyle or what you're doing on a day-to-day basis?
I moved into a new house, or it's an old house, but to me it's new. Yeah.
Okay. Have you gotten on any new medication recently?
No.
Okay.
No.
And when was your last examination by a doctor?
It's been about 2 years. Yeah, it's been a while.
You know that feeling when you find something truly special, that looks great, feels good, doesn't break the bank? That's exactly how I feel about Ana Luisa, a sustainable jewelry brand from New York that creates affordable, luxurious jewelry. I've been so excited to share these new pieces I got from Ana Luisa. Their jewelry is not only stunning, but also crafted with sustainability in mind, which makes it even better. I have some of their pieces from before, and they've held up beautifully over time. I've worn them every day, so I can confidently say the quality is amazing. And guess what? Now is the perfect time to treat yourself or someone special, because Ana Luisa's Black Friday special sale is the biggest of the year. You'll find these amazing, luxurious pieces at unbeatable prices, and they will make for an amazing gift for someone special. These deals are only available for a limited time, so if you're thinking of getting gifts or just want to add a little sparkle to your day, don't wait too long. Some of these pieces sell out super fast. It's hard to resist. So click the link in the description down below and check out Ana Luisa's Black Friday special deals. Head to the link in my description down below to check out Ana Luisa's Black Friday sale and score your favorites before they're gone. Trust me, you don't want to miss out. Ana Luisa is having a huge sale of up to 35% off, and the more you buy, the more you save. Ana Luisa is all about affordable luxury. Ana Luisa jewelry is the perfect gift for the holidays. Score your favorites before they're gone. Ana Luisa is having a huge sale right now, up to 35% off. Click in the link and get your amazing jewelry pieces right now. Jewelry makes such a meaningful gift, and Ana Luisa's pieces come beautifully packaged, perfect for the holidays. So whether it's for you or someone you love, this sale is the perfect chance to make it special. Thank you, Ana Luisa, for being such a wonderful partner to this channel. Okay, has anything changed with you medically since 2 years ago?
No, not that I can recall. Everything's kind of been the same. I've been pretty healthy otherwise.
Are you allergic to anything?
Peanut butter. Yeah.
Have you found hard trying to stay away from peanut butter?
Very hard, yeah.
Peanuts are in everything.
Yes.
Okay. Can you show me one more time where that sensation starts in the body?
It kind of starts up here, travels all the way down the back of my scalp, and like pulling on my hair, and then down to my feet.
Okay. Back, and then it goes all the way down, so it's more of a full body sensory distortion that we're dealing with here.
Yeah.
Is there any pain anywhere in the body when you feel that sensation?
It's mainly tingling. Yeah, so it's...
How about any numbness anywhere?
I don't know. There could be. Yeah, I'm not sure. I mean, it feels tingly, but I don't know if, like, those sensations are because everything else is being numbed out or not.
Okay, so no pain. Any flu-like symptoms in the last 2 weeks?
No.
Okay. Any headaches?
Sometimes at night when I'm trying to sleep, I'll have a headache.
And where are they localized?
Just up here. Yeah.
Top of the head.
Both sides. Yeah.
Okay. And on a scale of 1 to 10, how intense is that?
I guess it'll be about a 7 sometimes at its worst.
Have you tried any medication for that?
Ibuprofen. And it does help.
That's good. Does the pain wake you up at night?
No. Usually I can sleep through it.
Any problems with your ears, your nose, sense of smell?
No.
Dry mouth?
I don't think so. Sometimes it feels like I'm smelling something that's not there, but it could be my imagination.
Okay. Any medical conditions running in the family that I should be aware of? Any genetic disorders?
No. My family's all pretty healthy.
Have you had any major surgeries?
No, I had a bunionectomy, but it was about 12 years ago. Just a very minor foot surgery, so yeah.
Any problems with that, or has it healed?
It's healed completely. It's great.
Okay, Katie, so I'm going to go ahead and give you a full body sensory examination today. Focus on physiological symptoms as well as anything that could be neurologically coming from the brain. And let's see if we can get to the bottom of what has been giving you these phantom-like sensations of being touched in the hair when you're not. Definitely feeling like you have socks when you don't. Could be an indication of some compression happening with the circulation in your legs. So I'm going to go ahead and check that out as well.
Okay.
Are you in any pain right now?
No. But in the exam, when you first started asking me questions, I felt that tingling. It's here in my hair. Yeah.
So you feel it right now?
A little bit, yeah.
So I'm going to go ahead and examine you while you're experiencing the symptoms live. So that should give us some more clues about what's happening.
Okay, sounds good.
I will start off by taking your vital signs. And I'll start off by listening to your heart and lungs. So go ahead and just breathe normally. I'm checking the heart for any murmurs. Any adventitious sounds that may be descending from the lungs. And I'm also going to use the bell side. I'm hearing S1 and S2. There are no extra sounds coming from the ventricular muscles, so no S3, no S4. Okay. I'm also going to listen to your lungs. Go ahead and take a deep breath in and out. Another breath in and out. Okay. Now a deep breath in and hold it for 1, 2, 3. Now we can exhale. Good. Okay, wonderful. So I'm not hearing any wheezing of the lungs. So no bronchitis, no adventitious sounds. I'm not hearing anything that may indicate any fluid buildup. Okay, so I'm gonna go ahead and check your temperature. Okay. This is going to go inside your mouth. If you can just hold it there for me for a few seconds. And I'm also going to check your oxygenation by using the indexing finger in my oximeter device here. Okay, let's go ahead and check the temperature. That should be enough. Good. So I'm reading about 98.7. No fever. 99.5 oxygenation and a very healthy beat to your heart of about 75 beats per minute.
Okay.
Are you an athlete?
I run, so it's not like I'm a professional athlete, but I do distance running in my spare time.
Very good.
Yeah.
Definitely keep up the exercising. A lower heart rate on average is indicative of very good level of oxygenation in your blood, good healthy muscles. 98 temperature, healthy lungs and heart. Oximeter showed a within range reading for levels of oxygen. And I'm also going to check your blood pressure.
Okay.
Have you had any troubles with that? Any hypo or hypertension? Anything running in the family that maybe I should be aware of?
No, not that I can recall. Yeah. Okay. I think it's pretty good.
Wonderful. So let's go ahead and slide the cuff right here. Okay, so that's gonna go right above the brachial artery, and let's make sure that we uncross our legs. Okay. So your blood pressure is a little bit on the low end. Okay. Nothing to be concerned of. Just lower than average.
Okay.
Are you feeling dizzy any chance right now?
No, maybe a little sleepy, but not too dizzy.
Okay. So I was able to read 110/60. We'll make a note of that and we'll cross-reference it with the reading from the next appointment and see maybe this is just a baseline normal for you.
Okay.
Okay, so next up I'm going to do just a visual inspection of your body, your face, and just make sure I'm not missing any external signs of any symptoms. So go ahead and just relax. I'm going to just perform a visual inspection. And I'll start off with the face. The top frontal cranial area. We mentioned that the tingling sensations start. I'm also going to observe the inside of your arms, checking for any abnormal colors, any skin rashes that may be triggered by neurological disorders. Not seeing any signs of any palmar erythema. All right, you can go ahead and lower your arms. I'm also going to palpate your head.
Okay.
Is that okay?
Yes.
Checking for any masses or any abnormal pain upon normal to light palpation. Applying lateral pressure and median. Good. No pain is noted. Touching the mastoid bone process and checking the lymph nodes. the preauricular lymph nodes and posterior auricular. Occipital in the back. Tonsillar. Submandibular and submental. Going down the neck, checking the cervical and deep cervical lymph nodes. As well as the supraclavicular. Can you shrug up for me? Good. And now lower. Perfect. That feels healthy upon palpation. And also checking the pectoral and axillary lymph nodes. Good. Non-inflamed. Good. Wonderful. Just going to take a couple of notes of that. Physiological exam of the head showed no positive findings. Healthy lymph nodes and the mastoid bone process not infected. Okay. Wonderful. Alright, Kitty. Next up, I'm going to check your eyes. Okay. When is the last time that you've had an eye exam done?
It's been over a year, like a year and 6 months.
And was that all healthy? Are you wearing contacts now?
Yeah, so my contacts prescription hasn't really changed since I was like 19. So it's been kind of the same. And the last eye exam had the same result. So I feel pretty good about my prescription. I can see pretty well, I think.
Wonderful.
Mm-hmm.
Okay, so I'm going to go ahead and ask you to just look into the distance for me. I'm going to shine my light in your eyes for a little bit and check the pupil response. Good. And across from below. And again from the top. Good. And now I'm going to ask you to look at my nose here. I'm going to just slide my light across and then one more time. Wonderful. I'm also going to measure your pupil, which is about 2.5, so normal. Okay, now I want you to look up for me. I'm just going to take a peek at the conjunctiva and sclera. Good. Now look down. Perfect. Good. Wonderful. I'm going to use my ophthalmoscope here. Take a look at the optic nerve, optic disc. Go ahead and just look into the distance of that poster over there. And I'm just going to calibrate my device first. Make a note of the density and make sure I can see you clearly here. Perfect. Now I'm just going to come closer and just okay, so I'm able to visualize the optic nerve Optic disc has a good ratio. No abnormalities. No scratches on the cornea. Good. Wonderful. We're gonna do the same on the other eye. Okay. Head straight, and just for a little while, I'm gonna shine my light again. Good, healthy optic nerve. No popped blood vessels. Good, looks normal.
Okay, very good.
Okay. So next up I'm going to switch off to my otoscope here and check your ears. Okay, have you had any problems with your hearing? Anything you'd want me to know?
No, not that I can recall really. My hearing's pretty good. Yeah.
Okay. So let's go ahead and check the inside of the ear.
Okay.
And I'll start off with your right ear. Perfect. And I'm going to inspect the auricle and the behind the ear area for any infection, any discharge, any abnormal moles or skin growths. Okay, now I'm going to visualize the ear canal. Okay, I can see all the bony landmarks. Tympanic membrane is pearly gray. Good ratio on the margins. Cone of light is there. No redness. Wonderful. Okay, I'm gonna do the same on your left ear.
Okay.
Okay, if you can move the head towards your right slightly. Okay. A little bit of wet wax. No other discharge. Tympanic membrane has the same expected pearly gray color. Bony landmarks are there. And a little bit of discharge, but not concerned about the color. Okay, wonderful. So that's a normal ear exam. Wonderful. So no positive findings. Okay, let's go ahead and do a couple of sensory tests, focusing on your forehead and the upper body here. Okay. And I'm going to start off with a cold object here. And I'm going to touch you on the left side or the right side of the body and try to identify which side it is.
Okay.
All right. Keep your eyes closed. It's going to be a little bit cold.
Left.
Good.
Right. Left. Right. Left. Right. middle, middle.
Very well. And next up, we're going to go into something a little bit more distinct here. So I'm going to touch either with a sharp object or a very dull one. Go ahead and say sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Interesting. So I'm noting some sensory differences. You've definitely gotten a few of the tests wrong. So sharp or dull, that was not a pass. The cold sensation, you were able to identify that pretty well. But there may be some sensory damage that we should further explore.
Yeah.
Okay. Let's go ahead and do another test. So continue keeping your eyes closed.
Okay.
And tell me when you stop feeling the sensation.
Now.
Okay.
Now. 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 Now.
Good. And was that about the same on both sides of the face here?
I think so. Yeah. Yeah.
All right. I'm also going to give you something to taste. I'm also going to give you something to taste, and that will allow me to detect any damage to the cranial nerves that control the sense of taste.
Okay.
I have here a paper that has an essence. Okay. What does that taste like?
Sweet.
Wonderful. So that was sweet. Now let's try a different taste. This is slightly different. Bitter. Yep, you were able to identify that just fine. And finally, something that's very different from those other two, but a little more subtle. Okay, maybe on this side of the tongue.
Huh.
There you go.
That was very, like, almost chemically. So I guess really bitter as well.
Yeah, that was actually sour, so
Okay, yeah.
there's a little bit of
I understand that.
mix of sensations for you.
Yeah.
All right, let's try something to smell.
Okay.
Next. To continue checking the cranial nerves.
That smells like rosemary.
Yes, that's correct. Let's try something different, but I'm going to obstruct one of your nostrils. What is that?
Stinky. Like meat.
That's actually supposed to be a rose, perfumey, sweet smell.
Ooh, okay.
So cranial nerves 5 and 6 are putting a big question mark around them. Taste mix up as well as smell. Okay. Let me go ahead and just feel the nose and see if I detect any lumps, anything that may be a physiological abnormality.
Okay.
Sometimes we may have infections of the nose here, the bone inside, that we may not be detecting them in any other way except through a loss of smell. Okay. Checking your sinuses too. Good. So no deviated septum. Any pain here?
No.
Any pain here? No. Okay. So I'm not detecting any abnormalities of the nose. I'm also going to take a very quick peek inside the throat. Okay. And check for any infection. So go ahead and give me one big okay. Yep. Uvula is present, not inflamed, no redness, no swelling, so there shouldn't be any physiological reason, at least as I'm able to detect from the outside.
Okay, good.
All right, let's go ahead and take a look at your abdomen and your back.
Sure.
So I'm going to go ahead and give you a medical gown and have you lay down on the table.
Okay, all right. Thank you.
I'm also going to check the scalp and try to see if I can detect any skin abnormalities, any conditions that may correlate with sensory distortions. First, I'm going to palpate the top of the head here. And perform a light percussion. Can you count how many times I'm tapping you?
Yes. Once. Twice. 3 times. 4. 1.
Good. So no sensory loss upon tapping. I'm gonna check the symmetry of the head. Okay, about 12 across from one eyebrow to the top of the head, and then from the other one about 8. Okay, very good. observing the skin. Checking for any reactions upon light scraping. And performing a scalp inspection. Scalp looks healthy. I'm not seeing any excessive sun damage, no redness, no dandruff. No infection of the hair follicle. Okay, I'm just going to part the hairline here. Try to get a straight line. Expose the scalp and see if we can detect any nerve damage through some sensory tests. I am detecting there is a red dot that does not look like a mole. And a little bit of skin irritation from what I can tell. Alright, I'm going to go ahead and cause a vibration, and I want you to tell me if you feel it first and then when it stops.
I feel it. It stopped. I feel it. It stopped. I feel it. That stopped. Sorry. It stopped. I feel it. It stopped.
Okay. Now go ahead and apply a little bit of moisture and the magnesium solution to help relax the muscles.
Okay.
And provide some hydration. Okay, that should help improve the skin. Taking another look at a random location in the scalp. I'm not seeing any folliculitis or ringworm or any abnormalities, but there is a little bit of dryness. Okay, that should help hydrate this patch of dry skin here. Could just be due to sun exposure. Okay, Katie, I'm going to take a look at the abdomen next. Is it okay if I unbutton the gown here?
Yes.
And is it okay if I lower your trousers a little bit? Starting off with the visual inspection of the abdominal area. Looking for any visible signs of any masses, skin elevations. Checking for any raised moles. You do have a couple of moles. When is the last time you've had a skin exam?
I haven't.
Okay. A couple of moles that they're all one color, well-defined borders. There's just a lot of them, so I would keep an eye on them.
Okay.
Usually I recommend patients that have a lot of moles, more than 200, and it looks like you have about 20 on your abdomen, so you may have more on the rest of the body, to recommend seeing a dermatologist every 6 months.
Okay.
I'm going to go ahead and listen to the abdominal sound. Healthy level of digestion is heard. Normal level of auditory responses in all 4 quadrants. Nothing indicative of fluid buildup. Wonderful. I'll go ahead and palpate. I'm feeling very strong abdominal lower muscles here. You can definitely tell that you're working out. Very strong abdominal muscles, even while you're relaxed. Checking the spleen underneath the left rib cage. Has a normal, uninflamed size. The stomach also feels quite normal. And the umbilical area does not present any pain. Pressing down on your kidneys. No pain noted. Let's go ahead and check the dermatomes in your abdominal area as well. So sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
And it's going to be wet or dry.
Okay. Wet. Dry. 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 Wet. Wet. Dry. Dry. Wet.
Very well. And I'm going to do some light tapping next.
Okay.
To just make sure there's no fluid buildup and that the resonance of the sounds is normal. Good. That's quite normal. Okay, I'm gonna go ahead and button up your gown and then I'll take a look at your back.
Okay.
Okay, Katie, so I'm gonna go ahead and take a look at your back. And is it okay if I unbutton the gown?
Yes.
Let's go ahead and just visually inspect the back. See if I can detect anything that may be an explanation for those sensations. checking the spine here. Perfect. It's very straight. Then let's check to see if there's any fluid buildup. Good. Healthy resonance sounds. Good proportions. And is this sharp or dull?
Dull. Sharp. Dull. 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 Sharp. 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 Dull.
Okay, Katie. So let's go ahead and take a quick look at your legs and feet.
Okay.
And then we'll discuss the results.
Okay.
Okay, Katie, so let's go ahead and take a look at your legs and your feet. And you've mentioned feeling like you have socks on when there aren't any.
Yeah.
Okay, so
Yeah.
is it okay if I remove the socks?
Yes, please.
So I'm gonna just lift this a little bit. Take that out. And this. Okay. Let's go ahead and just palpate first. See if I can sense any fluid build up. Any pain when I apply light compression here?
Feels a little tingly. Yeah. Not painful.
They are quite cold. Is that normal for
They
you?
get very cold. Yeah, very easily.
There's no edema, but I am a little concerned about the change in temperature gradient from your legs all the way to your toes here. Okay. Can you wiggle your toes for me? Got some good mobility there. Gonna check your pedal pulses. Two plus, synchronized. Can you push into my hands with your pad? Good. Good level of strength there. Just check the capillary refills. Two plus. Very good. And can you close your eyes and tell me which leg I'm touching, you left or right?
Okay. Left. Right. Left. Right.
Very well. And now can you count how many taps you feel? Keep your eyes closed.
2.
Okay.
2. 2. 1.
Good.
4.
Good. do the Babinski test. Good. Good, no positive Babinski. Very well. And can you tell me if you feel sharp or dull?
Yes. Dull. Sharp. Sharp. Dull. Sharp. Sharp. I didn't feel anything.
So a little bit of sensory loss over here, especially over your toes. How about this? Can you feel that?
Yes.
And how about that? Can you feel that?
Barely.
So some numbness. How about that?
No.
And is this wet or dry?
Wet.
Okay, so you could feel that sensation. And is this sharp or dull?
Sharp.
And how about that?
Same. Sharp.
Okay. So I think we need to investigate a little bit the sensory loss and possibly do an MRI to check the internal organs, just make sure that nothing pops out that we should further investigate. So we're gonna go ahead and do that. And then I'd like to see you again in about 6 weeks.
Yeah, that sounds really good.
All right.
All right.
Thank you for coming in today.
Sure. Thank you very much.
I'm gonna go ahead and put your socks back. That's 1. And 2.